I really appreciate you meeting with me, virtually meeting, I guess.
Yeah, I don't mind at all. What else are we all doing?
Right. So just wondering, like, what do you do at Planned Parenthood? What's your role there?
I am overseeing all electoral work and community outreach and some community education and events as it pertains to gaining support, public support and visibility for Planned Parenthood.
I was just going to ask, you already mentioned it actually, that like with the coronavirus, there's definitely been limits in like abortion access and stuff. So
Mhm.
just wondering, like, what is Planned Parenthood doing? Are there any other issues kind of similar that Planned Parenthood is involved with?
So we're fighting at the state level. We've got a huge public affairs team across the state, and different folks are dedicated to different things. So we have people who are specifically focusing on policy. So they pay attention to the bills that come in, how they're written, if we think the way they're written is good and effective for protecting reproductive health and rights. And we have that team that kind of passes down the message. This is the bill that came in. This is what's wrong with this. This is how it attacks or protects reproductive health and rights. And this is what we can do to fight it. So when the response package was being put together, it was flagged that there was anti-abortion language in there. And the message passed down to folks of us that aren't working with policies as much all the time, where we were just encouraged, spread this message. So what we really did was we spread a petition to fight it, and just as much data as we could about what that looked like, how that could affect it, and why abortion is essential health care. Um, so as far as that specific response act, that's really all we did was visibility and spread the message. Um, Other than that, the health centers themselves have been pretty affected by COVID because we might be thinking about all the resources that hospitals need right now, and they absolutely need those resources. And they're jam packed with patients needing care specific to COVID, but that doesn't mean that other healthcare needs to stop. And if anything, people are at home right now with not much to do. And let's be honest, a lot of people are probably having unprotected sex.
Mhm.
Um, and so our health clinics are just as needed, the health centers. I mean, um, what we've started doing though to keep the safety of our staff protected, the health and safety of other clients, because imagine someone is coming in and all they need is the pill, they need the birth control pill. Do we want to put them at risk to come in and get that pill if, say, someone else is in for an in-person procedure that they need to come in person for, and they could potentially have COVID? So how do we protect our patients while still serving them? So some things we've started doing is we are delivering birth control methods by mail. There's also curbside birth control pickup. If somebody needs to get an STI test or something, we just have safer ways to get them in and out a lot quicker. We're taking temperatures at the door. We're asking folks if they've been exposed to anyone, if they've traveled, et cetera, et cetera. And we're really trying to prioritize the care for folks who need to come in and do in-person services. And that varies by clinic to clinic because the Green Bay Clinic offers the pill, the medical abortion pill, but we do not do in-house, surgical is not what we like to say, but in-house abortion at that clinic because we don't have the equipment or the capacity. So we, in Anna-Schwabenon at least, have not seen that effect. But from what I've heard from the health centers across the state, it's been, prioritizing those folks who are maybe beyond the 8 to 10 week limit
Mhm.
for a medical abortion pill that need to come in and get the in-house one. Um, so that's been our response. I can't speak much more to the health center's response to COVID, only because that's not what I do most of the time, because I'm not a health center staff. Technically, I'm a public affairs staff.
What can people do to help support Planned Parenthood and everything that's happening? Like, how
Yeah,
can like a normal citizen help out?
I think folks' first thought is Planned Parenthood needs our money and they need our donations. And while that's a part of it, the thing we need a lot more is public support. And that means raising visibility and awareness about what the health centers are, what they do, changing the narrative that all we do is abortion and that we're doing it intentionally all the time when that's just not true. And we're giving people the full range of options for family planning. So when COVID started, we had to reimagine what engaging our supporters was going to look like and how we were going to keep gaining support in general. So we've transitioned everything to virtual, just like everywhere else has, from the public affairs perspective. So we are doing um, virtual events, virtual webinars, trainings, panel presentations. We're inviting people to share our petition with their communities. And we're trying to really focus on social media outreach, how we're accessing new communities and engaging them. Um, so we'd like people to attend our events for sure. We'd like them to spread the message that Planned Parenthood does more than um, more than even just the health services. We do trainings and we do events and we support other organizations. We have partnerships with Voces de la Frontera, who works on immigration rights. We have partnerships with tons of different social justice orgs across the state and across the country. And we're constantly doing social justice work. And I think folks don't think that when they think Planned Parenthood. So right now we're just asking folks to stay engaged in what we're doing, share our petition, share what we're doing, support us just like vocally and with your friends, and talk to people about voting. We have a relational organizing program where supporters can help us with outreach and with engaging their networks to talk to them about why voting matters, why they should vote Trump out, and then who they should vote for, or how they can vote in support of reproductive health and rights. Okay. Well, thank you for thinking of me.
Oh, thank you so much for meeting. Oh my gosh, I enjoyed it so much.